want to ask one last question, Dr. Peters, which is to get to the point that I think I understood Scout making when we were talking, and that is there any role for some larger kind of screening for people who might be exhibiting personality changes or psychiatric symptoms, and it's not immediately obvious, but you might wonder whether
Sure.
there were.
I think the answer is almost certainly yes. I mean, a lot of the cases that I take care of are those cases that there's just something extra going on, headaches, pressure, and you just wonder what else might this person be going through. I think with a lot of the autoimmune encephalitis cases, those sometimes go years before it's identified, and some of the identification only happens because of a seizure or because it got bad enough. But yeah, whether it's hydrocephalus or one of the other neuroinflammatory disorders, I think we miss it quite often.
What would the main indications be for putting someone, sending someone for screening? Would a headache be?
Yeah, I mean,
headache.
Typically, we'll see subtle neurologic exam findings in the cases that we take care of that don't necessarily map onto a single part of the nervous system, but it just like looks or feels different. And I mean, in my practice, we get a lot of neuroimaging, so we don't miss that often. And I think a lot of the residents are trained to get neuroimaging when there's a question about, do we actually know what diagnosis this person has? But if it doesn't feel typical, I think as you gain your experience, you start identifying people that there's just something extra going on, and you got to figure out what it is. But it happens quite often in the cases I take care of.
Okay.
Yeah.
Well, thanks so much for great grand rounds. Thanks to Scout. Thanks to the O'Donnell family. Thanks to Dr. Luciano.